I'm Elizabeth Klee here at Atlantic Health Systems at North Pavilion in Clark, New Jersey. I'm here today with Jessica, and we're here to talk about breast health, and specifically about screenings. So Jessica, can you just tell some of our viewers what's important that they should know about having screenings, why do them, how often?
Sure, Elizabeth. Thank you so much for coming out today. One thing I would stress is normally for screening mammography, we require that patients are 40 and up. For screening mammos also, that would be a patient that has no breast issues or complaints, that their doctor is just giving them a prescription for their yearly checkup.
Okay, so just a overall check-in, make sure nothing's going on.
Correct.
We have no suspicions that there's any problem.
Correct.
Okay.
Although also in the state of New Jersey, if a patient does not have a prescription from their provider, that's okay. In the state of New Jersey, we are allowed to do screening mammography on patients without a prescription. It's considered what's called a self-referral. And those patients can come in, have their screening and mammography done. If anything else were to be needed, then they would get a different sort of prescription at that time.
Okay, all right. So if somebody's never come in, want to tell them a little bit about what we're standing next to?
Sure, of course, I'd love to. So here at Atlantic, we have a beautiful state-of-the-art GE Pristina piece of equipment for our mammography unit. One thing that is so nice about this unit is that it's very light, bright, and open, very not cumbersome. So we also have Sensory Suite connected with it. So there is imagery as well to just make your experience a little more comfortable. If a person has never had any type of breast imaging before, one of the things they can expect is basically you're just going to be having a few quick images of the breast, anywhere between 2 to 3 pictures on each breast, and then you're ready to go. And the doctor views them, later in the day or the next day and gives out a reading on the exam.
Okay, so for our viewers, you can't see it, but behind this machine, there's a wonderful screen going with all views of nature and some sounds that we had to shut down so that we could have a conversation.
Correct.
But it is very relaxing. As a matter of fact, when we're done, maybe I should work here. Oh. It's a lot quieter than my office.
Yes.
So if someone has never come for a screening of any kind, how do they prepare? What do they have to do before they come? What do you tell them?
Oh, sure, Elizabeth. So really there's not much preparation for screening mammography. We just ask, if possible, that you not wear any deodorant or powders or lotions in the underarm area or around the breast area the day of the exam. A lot of times that can't happen. Maybe if patients are coming straight from work later in the day, maybe they've walked in hoping just to get in for an appointment. Mm-hmm. So pretty much anywhere you're going to go have any type of breast imaging, there will always be what we call wipes that are provided. So if you happen to have that on, you would just remove it prior to the images being taken.
Okay, so no prep work at home.
Pretty much no.
All right. So what do you hear from women that have been afraid to come, finally came? What are some of the myths? What are some of the fears that you hear from ladies when they finally get themselves
Sure,
here?
I'm so glad you asked this. One of the biggest things that I hear from patients, especially what we would consider a baseline patient, or that is a patient who has never had breast imaging ever, their very first one. A lot of ladies come in, they're very concerned just because they're not sure what to expect. It's that unknowing factor. The first thing I always tell them, funny enough, is I promise this is not what you think it's going to be. Everyone hears stories from their friends and their family members, and you come in with this expectation of something pretty horrible, and in actuality, it's not. It's very fast. Of course, listen, there is compression, so it is a little uncomfortable, but it is fast. And I always try to tell everyone it's not going to be as bad as what you think. It's quick. And the outcome of being able to make sure that your breast is good and okay far outweighs just a little bit of discomfort that you're having for a moment.
Somehow I wish you were the person I met the first time I had that done.
Well, thank you.
It makes it a lot. Yeah.
Thank you.
And by the way, that's all true. So what other things do you think it's important for women to know about breast health? And what if let's say I have a concern because there's a family history of breast cancer, and what do I do?
Sure. So a lot of times when patients go to their general providers, a lot of the family history is reviewed, right, at your appointments. Sometimes maybe that gets skipped. Maybe since your physical, you found out a different, information from, year to when you're coming in, right? So a lot of times if you if you were to give that information to your provider, maybe if you have a strong family history, they might start your mammography a little earlier or your breast imaging a little earlier. Sometimes we do combinations depending on how strong that family history is with maybe mammography, ultrasound, and alternations with breast MRI. A lot of that is left up to the providers or to breast specialists, i.e. a breast surgeon. A lot of times patients who have a very strong family history will be sent over to a breast surgeon for maybe some genetic testing, which is called BRCA gene testing.
So then I guess my other question would be, so let's say I come, I have my screening, and then unfortunately we find some type of an irregularity in it. So then what happens?
Well, a lot of times it's not necessarily that there's something super concerning. It can be that there's just been the slightest change since your prior mammography. In those cases, the mammo-radiologist that's reading the exam might ask for maybe a additional type of mammogram image, different angle, different paddle, maybe an ultrasound image. It's not uncommon. I always try to tell my patients while they're here for their screening mammographies, if you receive a phone call from us stating that we need more images, please don't worry. It's not necessarily that there's something wrong, it's that any slight change whatsoever needs to be documented over time so that there's a consistent running image. Exactly, that they will be able to follow. So at that point, the patient would be notified by phone. They would come in. It's a different kind of exam, not so fast in and out. You would have your special images taken while you're here. The doctor would review them, would let me know if there's any other additional images needed, and then you would leave with results at the end of your exam.
Oh, really? So then there's not necessarily, I have to walk out of here and worry for the next 2 weeks and wait. I'll walk out with some results and have an idea of if there's next steps or if I can just go home and
Correct.
do
You would receive results that day. If it were a result that was all good, of course that information is relayed straight over to your physician and you're all done, ready to go. If it were a case that the radiologist felt that a biopsy were needed, you would be what's called navigated by our nurse navigator, and your doctor would be, your ordering provider would be notified at the time that a biopsy is warranted for what has been seen. And that nurse navigator is the person that would take care of all the coordinating, appointments there out, things like that for you.
I love that name, nurse navigator. That's awesome. No, but you need that, right?
You
so
need
something's
it.
wrong, the last thing you want to do is worry.
Exactly, and it's very important. It takes a lot of the stress off. That person coordinates everything between our group and the ordering providers group, making sure that all those orders are in, that they have all the test results, so that also your provider can check back in with you as a patient to make sure how you're doing as well.
All right, awesome.
Yeah.
Awesome. So you heard it here, you heard it from the experts. We hope you'll think about coming in and taking care of your breast health as well. Jessica, I hope that people find your smiling face when they come.
Oh, thank
you for taking time with us today.
Thank you so much for coming out. I really appreciate it.
We're still here at Atlantic Health, North Pavilion in Clark, New Jersey, and I am sitting now with Paul, who is the assistant manager of the imaging center here.
Yeah.
I really appreciate your time today.
Oh, thank you for coming out and visiting our site.
We had some great conversations with Jessica in the mammography suite about the importance of it and how it works, maybe hopefully dispelling some of those myths that people are afraid of. But I do want to ask you, so what would you say to a woman who's still, even after seeing that, is still afraid to come in? Maybe she's waited too long, she's let too many years go by, and now she's just petrified to come.
Yeah, with Atlantic Imaging Services in Clark, the number one thing that we strive for is patient care. From the minute you check in to fill out the paperwork to the minute that Jessica brings you in, and that very minute when she brings you in, she starts explaining the procedure and what to expect. And that goes for all our modalities that we offer here in Clark. So she'll bring you in, she ensures and gives you the utmost best patient care that you'll absolutely have, because that's one thing that a lot of patients that we come across, when they come to our site, they had a bad experience somewhere else, whether it be lack of explanation or just the overall experience of the examination. And that's one thing that our site strives for, is patient care. And we also have the state-of-the-art equipment here. So not only will you get the utmost best patient care in our facility, but you will get the best quality examination with our radiologist reading it and making sure that you get your results in a timely manner.
So with all we've said, what if we still don't have some woman convinced to come here? What if she's still afraid? She still doesn't want to know. She thinks, oh no, what if I hear something I don't want to hear? What would you say, bottom line?
Bottom line is that early detection saves lives.
So Paul, I noticed this thing that says hashtag ask her, and it's on a board about breast cancer risk factors. Tell me what the hashtag ask her is about. Who are we asking? What are we asking?
Yeah, so the Ask Her campaign is an Atlantic Health program where we encourage patients to ask their loved ones, moms, sisters, grandmothers, aunts, ask her if they got their screening mammograms and any other preventive exams, where we nag them and make sure that our loved ones are on top of their health and by getting their screening mammograms and other preventive exams. And that doesn't stop there. We encourage patients in general to ask their brothers, their uncles, their dads, their grandfathers, if they have done their preventive exams, whether it be a calcium score, a lung cancer screening, and those type of service we offer here in Atlantic Imaging Services. And we have state-of-the-art equipment to help get the best examinations for your loved ones. Nag your loved ones to make sure that they are on top of their health, because my mom used to say health is wealth, and that's one thing that we encourage our patients to be on top of, and making sure that they're getting their yearly screenings and everything like that.
Let me ask you something. So, people get to certain ages and they say, oh, at 30 you should do this, 40 you should do this, at 50 you should do this. How do people find out what they should be doing in terms of screenings? So, I can go ask my brothers, I can go ask my dad, but how do I know what they should be doing?
Yeah, and it's one of those things you could always ask your doctor when you go for your yearly checkup, what type of examinations that they could do to be more proactive. And for example, there could be a calcium score, and we offer those types of services here with ultrasounds, the MRIs, the CAT scans, and we do have state-of-the-art equipment to do those type of exams.
Awesome. I'm assuming we could find out on your website all the kinds of exams that you offer here?
Yes, we do.
All right, awesome. Is there anything else you want to tell folks about your commitment to patient care?
Yeah, so the number one thing, patient care is the utmost thing that we strive for. And, from the minute that you walk into that door to the minute you walk out, you're going to get the best care as possible. And on top of that, we have, like I said, mentioned many times, that we have the state-of-the-art equipment to do this type of testing. And, and that's the types of service that not a lot of people know that we offer here in Atlantic Imaging Services.
Awesome. Thank you so much for your
You're
time
welcome.
today, Paul.
Thank
Really
you so much.
appreciate it.
Yeah, thank you.
Thanks.
Thanks.